What can you do with 5 kwacha? Not a lot. A 5 kwacha Auto Boost can get you 1,900 kwacha extra IO cover. Bernard Mulindu auto boosted, and Bernard received a total payout of 2,070 kwacha when he needed it most. Here is Bernard's story.
My name is Bernard Mulindu. I am from Kenya. Kayeni hospital check. It's a 5 problem. 296 cash. Ngasanya kwa chat. Wametumira kwa 2 piece. Kaya manda kusongera tukara mukurazichi akura tawole bomba. Alipira kwa abana ku masuku. Aba bali bombe tuyisuma sana.
Dial star 296 hash to auto boost and quickly grow your IO recharge with care cover each time you recharge. IO together with MTN. IO, because you care.
So, welcome to Ask Dr. Mjajati Sunday, brought to you courtesy of IO. IO is an insurance company owned by MTN, basically providing you with micro insurance to your doorstep. It's a very easy insurance to use, very easy to pay the premiums, very easy to claim as well. So take advantage of it while you can. Now, today we are going to discuss a very important subject, and this has to do with contraceptives. A lot of you, ladies and gentlemen, have been asking us to have a conversation around contraceptives. You know, the different methods. There's been a lot of questions. Some of you ladies are concerned that some hormonal contraceptives have, you've heard that they make women stop having children and things like that. Which methods work, which methods are okay, which methods are not okay, issues of that nature. So tonight, we are going to have this conversation, and we will make sure that by the time we are done with this conversation, a lot of your questions will be addressed. Secondly, as usual, tell us where you're watching us from. Remember, we are always interested. And like I promised you, we have a guest this evening. And tonight I am joined by none other than Dr. Muyuni. Dr. Muyuni, how are you?
I'm fine, thanks, Doctor. How are you?
I hope you had a great weekend. I hope you had a great weekend.
I did. Thank you so much. I'm ending my leave, so back to work full time tomorrow.
Back to reality.
Back to reality.
Right. So I'm sure the ladies are quite excited to see you. From our last conversation that you featured, a lot of ladies have been asking me to bring you back. And thankfully, again, we are grateful to you that you made the time. And today, Dr. Muyuni, we are addressing the issue to do with contraceptives. So, to set the stage, we are going to go through the different types of contraception, both hormonal and non-hormonal, emergency and non-emergency contraception. But before we go any further, as usual, for the people who are watching you or listening to us for the very first time, kindly introduce yourself so that they know who we are talking to. Who is Dr. Muyuni?
Okay, I'm Dr. Mutinta Muyuni. I'm an obstetrician gynecologist, and I practice here in Lusaka in private practice. And I'm very keen about educating the public on sexual reproductive health matters. And so I was very excited to be called on today to discuss on birth control. I love receiving babies. I'm quite biased, always looking forward to the next pregnancy, but it's a very cardinal discussion, discussion that we need to have today. Thank you.
Right, Dr. Muyuni, as quickly, how would you define birth control in a manner that everybody's on board, so we're all able to follow the conversation clearly, and also the fact that we have men tonight who are listening to us, which is quite exciting for me.
Okay, so I think over the years we have come away from birth control being a woman's preserve. We have now come to a point where men and women are encouraged to attend, because there are a lot of things that need partner cooperation and partner understanding, and frustration of the female partner or the male partner may result in imperfect use of these contraceptives. So, to start with, what is contraception? Contraception means contra, against, ception, falling pregnant. It's basically preventing or prevention of the pregnancy taking place one way or the other. There are different methods that are there.
Right.
So
So
that's
now,
contraception.
right. So now, what we're going to do is that
Mhm.
we'll go through all the methods. Let's start from here. I will leave the hormonal issues or hormonal methods towards the end, because I think that's where a lot of questions are, and there's a lot of anxieties that come with those. But let's start from here. Let's start with barrier methods. What, in fact, maybe even before we go to barrier methods, let's start with natural methods of contraception. What are
Okay.
options? What options are there with natural methods of contraception?
So, natural methods of contraception basically look at the timing of the cycle and
Right.
predicting the fertile period and avoiding contact during that fertile period. There are different ways. Some look at the basal body temperature, some look at, for example, the mucus becomes from the female, becomes
Yes.
thin and stretchy, like flu mucus. That's a sign that someone is in their fertile time. So, to avoid intimacy during that time. Others use ovulation indicator kits. They pass urine, and that kit is able to tell you if you are ovulating during this time. Um, Other simply use the dates of the period. Others will use sexual methods such as withdrawal during the intimacy to avoid ejaculation into the female partner that would predispose them to pregnancy. However, I'll hasten to say that it's 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 quite subjective. Each person, and I think we had started hinting on this at the last discussion about the menstrual
Yes.
cycle. Each person
Yes.
should know they are normal. Now, because the natural family planning method has worked for me, it may not work for the next person. It works better for those who have regular, predictable monthly periods. I've heard before also on this forum discussion about flow apps, for example. These are literally a lifesaver because women are able to tell as well as their partners. Partners also have flow apps now on their phones, and they're able to tell, yes, they're able to tell which is the fertile period and which is the time when to avoid. It is not the most reliable method, and if you are very sure you don't want a pregnancy by any means, you are better off leaning into other non-hormonal methods or other more reliable hormonal traditional methods as opposed to the natural methods.
Right. Now, let's go into barrier methods.
Mhm.
What options do we have, both surgical and non-surgical?
So for barrier, we have the condoms, male and female, and also we have things like the shields. The shields are not commonly available, or the caps. The caps are placed like a lid onto the cervix, and that prevents the semen from entering into the birth canal and into the womb. Whereas the condoms, the female condom and the male condom, they are placed let's start with the male condom. The male condom is placed onto the erect male private part, and then that is used during intimacy. Now, if you don't know how to use it, it's also a result. It may result in breakage or slipping off during the act of intimacy. As a result, you may end up with failure. So there's no harm in reaching out, coming to your health provider, and asking, how exactly am I supposed to use it? For the female condom, it has 2 rings. The first ring is slipped in. The second ring remains on the outside of the lady's private part, and then it acts as a net to also catch that. The beauty about the barrier methods is not only is it natural, doesn't disturb either partner per se, it also prevents sexually transmitted infections, apart from preventing pregnancy. The other birth control methods do not have this added advantage of protection against sexually transmitted infections like syphilis, HIV, and other common sexually transmitted infections. So those are barrier methods that are commonly used. So what we have,
barrier methods?
Well, surgical barrier methods, not very commonly done. And I'll state what is done here. I think to use a surgical route would be going into permanence. I would like to believe you are talking about bilateral tubal ligation.
Yeah, BTL.
Okay. So the surgical methods are for people who are certain they are done with their family. They are satisfied with the number. For the women, it's more common and more acceptable. A small incision is made on the abdomen or on the belly button, and then the fallopian tubes are accessed. The fallopian tubes are then ligated or tied off, cut and tied off, such that the connection to the uterus is no longer there. There will be a gap of about this much. So it's not possible to fall pregnant unless by very remote chance the tubes reconnect during the healing process. But this is very rare. Once a surgical method is done, consider it as irreversible. Vasectomy also, the vas deferens of the male is cut, and as such, the testicles can no longer deposit sperm into the ejaculate. However, it takes a bit of time to reach from having about 20 million sperm in your ejaculate to 0. It takes some months actually post-procedure, and this is one thing where people get it wrong. With the vasectomy, people may immediately resume intimacy. Then when the wives fall pregnant, they say, look, what happened here? I've just had a vasectomy and now you're pregnant. You have to confirm that your ejaculate is down to 0 before you resume comfortably. Otherwise, once you've had your vasectomy, continue using your condoms or let your wife continue using another method until you have been certified now sterilized by way of doing a semen analysis to avoid challenging situations and the blame game. And then I'll emphasize again on the male sterilization. It's easier to do than the female sterilization, because the testicular sac or the scrotum is outside, as opposed to for the women, we have to open up the abdomen to access the fallopian tubes. But there's a lot of fear of maybe I'll become impotent or my sex drive or no. the way the sex drive will be affected starts from the mind. If you convince yourself you fail to perform, frequently you do fail, but otherwise, the vasectomy really has nothing to do with sex drive or failed performance. No. And as such, I encourage a good number of us who feel their women have taken birth control for long enough and they would like to permanently stop the flow, to consider vasectomy. It's readily available in almost all hospitals that have theaters at their disposal.
Right. Now, to transition to the other issue of hormonal contraceptives, I'd like us to talk about this particular method as we transition. It has to do with the loop, because I know the loop, you have the copper T, which has, that's probably doesn't have hormones, but you also have a loop that comes with, impregnated with hormones. Now,
Yes.
let's talk about the loop, especially the copper T one. What issues should women bear in mind about the copper T?
Okay, a copper T can be used by almost anyone. It has wide acceptability. It's non-hormonal, minimal side effects. But like the others, it offers no protection against sexually transmitted infections. And it's best placed in after a woman's period. When the cervix is a little bit open, it's easier to put in. And when you have it in place, you don't actually feel like, oh, there's something there. You don't feel it at all. One thing that you should have is a normal placed uterus. For example, if you have multiple fibroids, it means the inside of your uterus may have lumps and bumps. And so if it's displaced, you may fall prey to an unplanned pregnancy. So a uterus without fibroids or without any anatomical anomaly, or that is well formed, is a good candidate for a copper T. And the way it works is by forming an inflammatory response within the uterus and thickening the mucus at the mouth of the cervix, thus preventing the sperm from ascending. Should fertilization occur, there is no implantation within the cavity. So it's a good method that is better used in the long term. For example, I always say, if your memory isn't very good, where you are not going to remember to go to the clinic every 3 months or so, these are good methods. An implant or an IUD, a copper T or a Mirena, that can be put in the body and left there. There are some for 5 years, some last even up to 10 to 12 years. So it's a very good long-term method. Some of the challenges, however, that may be experienced from the IUD are that you need to check regularly after a period to just feel that the threads of the IUCD are still there. If you cannot feel them, go and see your doctor. A scan will be done so that we can see perhaps the threads have just curled up into the womb. If the IUCD is still perfectly located, there's no need to panic. The threads can be recovered at the time of removal. If you cannot feel the threads and we find the IUCD is dislocated, however, then we may need to remove it and either replace it or use another method. Excuse me. So those are, and then with the IUCD also, there seems to be an increased frequency with discharge. Of course, being a foreign body, discharge, episodes of thrush, intermenstrual bleeding, like spotting in between the periods, these should not serve as a source of discouragement. Rather, ladies should know these are normal and they can be treated. And once you know how to treat, it's easy to handle yourself. If you know how to handle the episodes of thrush, know how to handle the intermenstrual bleeding, know how to handle if you have the odd period pains, and of course, the heavy period flow can be handled with use of things like brufen or mefenamic acid. You will definitely enjoy using the copper tea.
Now, doctor,
Mhm,
I've had people complain that the
mhm,
threads of that copper tea, they've had their partners complaining that they can feel the foreign boat,
mhm,
particularly the threads. What's your
mhm.
advice on that?
So ideally, just after placement, we do recommend to our ladies, please give us feedback, because once you have a contraceptive, it's not the end of the story. We are still with you. Give us feedback. How is your partner feeling? Because if your partner is dreading now to have intimacy because of pricking feeling or on the, on the soft glands of the private part there, then your relationship will suffer. We trim the threads, make them shorter, or reposition them. We may even cut them off completely, depending, so that we enable you have your intimacy in a in as comfortable way as possible. Birth control methods is not a punishment. It's a means to an end at the end of the day. So if there's a feeling of pricking or anything that can be worked on, feel free. Be open with us as your providers. There's no judgment in these offices, no.
Now, doctor, there are some
Mhm.
women who have heard rumors that the IUD causes cancer, especially the copper T one.
Can cause cancer.
Yes.
Okay, so those rumors are basically without basis, because a lot of women feel when they use these cancer. But if you look at the genesis of cervical cancer, the main culprit is human papillomavirus infection
Mhm,
causing changes on the cells in the cervix. So those
mhm,
those rumors are unfounded and people shouldn't fear.
mhm,
The copper tea is a safe method to use. It's widely used. The failure rate is less than 0.5%. It's a very good method. On
mhm.
the other one, also the levonorgestrel IUCD or the Mirena, it's the placement is the same. It also has threads, only that with this one, it has added advantage. With the copper tea, it doesn't prevent ovulation. It doesn't prevent fertilization per se. But with the Mirena, fertilization is prevented as well as ovulation. So it is a better or more effective than the copper tea. But of course, it depends on how the patient is categorized, because it's a hormonal method, but it's widely acceptable. And the other benefits are reduced period pains, reduced, in some women, the period may go altogether, which is a plus for some women who don't want the period to be there. It's a very widely acceptable. In some countries, even some teenagers do use this copper tea um, for the hormonal benefits that it offers surrounding the benefits around the period pains, the heaviness of the flow. It's really good, only that the expense, I think, may be a restriction for most people. I think
Right,
the cost should be slightly over 3,000 kwacha in most chemists, but
yeah,
I believe in some public hospitals it may be available for free.
right. So this hormonal IUD, who
Mhm.
qualifies for it?
most women will qualify. Most women will qualify. I think if you fall in the category of the women who have had previous stroke or hypertension, history of blood clots, either in the lungs or in the legs, history of liver disease, history of cancer in the reproductive system, particularly also the breast. Those are the people who must use some of these things with caution. In these, it's not recommended to use any hormonal method. So the levonorgestrel contraceptive will fall into those. A healthcare provider will ask you even before, because these days we have to also deal with Google. People are well informed. As they are coming, they'll tell you the method they want to use. It's up to us as healthcare providers now to guide them on whether their choice is suitable for their health. So if you fall into this category, it may not be very effective. Even those who are on, for example, epileptic medication or TB medication, they may reduce the efficacy because of how these drugs are broken down by the liver. They may reduce the efficacy of some of these hormonal contraceptives. This applies also to the other hormonal methods that we'll be discussing shortly. So it's otherwise a widely acceptable method.
Good. Now, as we get into these hormonal methods of contraception, there's something I need you to address. Let's have a conversation around this morning after pill or emergency contraception, as the case may
Okay.
be.
I'm glad you bring it up.
Yes. How should emergency contraception be used? And when is it appropriate to say, I now need to go and get a morning after pill? And what is this morning after pill?
Okay. Morning after pill basically is a progesterone only type of pill that has high levels of hormone with it, and the aim is to prevent ovulation. It's more successful the closer to the event that you take it. However, some people tend to take it before they even start having the intimacy. They start the emergency pill. It's not supposed to be like that. It is just the way it is supposed to be. It shouldn't substitute traditional birth control. I think we have to get our perspective very correct here. You'll find that a lady is using emergency pill 3 times a week or 4 times in a week. In that case, if you are having intimacy so frequently, use a more convenient method. Just take a daily tablet. Why? Because the dose of hormone you are subjecting to in that emergency pill is very high. And to be subjected to it so frequently is not in your health benefit. You put yourself, whatever side effects you know about hormonal methods are multiplied if you take it more frequently. Ideally, an emergency pill is supposed to be a once in a month use. But I know that sometimes people prefer to say, I can't take the pill because of the side effects. I'll put on weight. I'll do this, I'll do that. And yet they take the emergency pill or the morning after pill very regularly. So let's be clear on this. And it has to be taken within 24 to 48 hours of the event, at least, even up to 72 hours if you are stretching it. The longer the duration, the less the efficacy. And if you recall, we talked about a regular period. If you've already ovulated and you've used an emergency contraceptive pill, these are the times when you hear, I used the emergency pill and it didn't work. It's supposed to prevent ovulation. If ovulation has already taken place, then it doesn't really make much difference. And every time you use an emergency contraceptive pill, at the end of the month or when you are expecting your period, please check quickly if it has worked. Because sometimes you may miss your period because of hormonal imbalance after using the emergency pill, or you may miss your period because you have actually fallen pregnant. So let's try and use them correctly. Let's our partners not also put us under pressure. I think, ladies, let's take control, because sometimes it's the men who come with these emergency pills per visit that they are coming for intimacy. So let's take control. Let's not overload ourselves with high doses of hormones in the name of preventing pregnancy. It's not healthy for you. It's better you use something lower dose, like a daily pill, then, if you are having sex so frequently.
Right.
In addition,
So, yes.
in addition, perhaps I would like to add, sometimes young ladies find themselves in a situation where you attended a party, you find yourself, you don't know how you fell asleep, you might have been drugged at that party, you look at your underwear, it's not the way you had it the night before, possible rape. You feel uncomfortable down there. Please don't shy away from hospitals. Get yourself checked. Get yourself the emergency pill at the hospital with guidance from your doctor, rather than hiding away. Like I said, there's no judgment in these offices. What we want is your health and your safety.
Right. So, Dr. Muni, here's what we're going to do. We are now going to go into the issue of hormonal contraceptives. You have tablets, you have injections, you have these things you put under the skin. But there are also other injections from other parts of the world that we have seen on the market that I'd like you to comment on. And then after that, we'll take a lot of questions. It appears we have a lot of comments and a lot of questions. But before we do that, let's just get a quick word from our sponsors, then we get into that very exciting subject as well.
All right.
What can you do with 5 kwacha? Not a lot. A 5 kwacha Auto Boost can get you 1,900 kwacha extra IO cover. Bernard Mulindu auto boosted, and Bernard received a total payout of 2,070 kwacha when he needed it most. Here is Bernard's story.
My name is Bernard Mulindu. Waimpongera na motoka. Kairi ko hospital check. Itakuwa ipo na problem 296 hash. Tunasanya kwa chatu. Ametumira kwa 237. Kairi amanda kusongera tukikala mukulazichi yako datawole bomba. Alipira kwa nabana ku masuku. Aba balipigwa wale bomben tuisuma sana.
Dial star 296 hash to auto boost and quickly grow your IO recharge with care cover each time you recharge. IO together with MTN. IO, because you care.
So, welcome back, and thanks to IO. And because of IO, we have Dr. Muni here telling us about birth control. And if you've just joined us, we began by talking about, Dr. Muni defined birth control, and then we went further to discuss issues to do with barrier methods. First of all, she began by talking about the natural methods, then barrier methods, and now we are about to go into these issues of hormonal contraceptives. But again, we spent a bit of time talking about the issue to do with emergency contraception. When do you use it? Why should you not abuse emergency contraception like most people like to do? So now let's talk about these hormonal contraceptives. I know they come in different forms, and this one brings a lot of questions from people, and I know that very soon we'll be discussing those issues. So walk us through these hormonal contraceptives, though.
Okay, so I think I'll broadly put them into the short-term methods and the longer-term, long-acting reversible. All of these are reversible contraceptive methods, the hormonal. And the main way they work is by suppressing the body's hormonal environment and preventing ovulation from taking place. The short-term methods include the mini pill, which is largely used after birth to 6 months for those who are breastfeeding, and the combined pill that can be used after birth from 6 months onward, or even in anyone who is in non-pregnant state. There are different types. You take one pill once a day for 3 weeks, and in the last week you take some red tablets. These are simply placebo or iron tablets, during which we expect a withdrawal bleed or your normal period to start. Of course, you have to continue using it. There's nothing like oh, I've used it for 6 months, now I'm tired, I'm taking a break. Once you stop using them, we expect fertility to go back to normal. This kind of pill, the type of lady who can use it is the type of lady who has a good memory, and of course, the risk factors that we looked at earlier of vascular disease or severe hypertension, that is not well controlled. Those are risk factors. Liver disease, and antipsychotic or antidepressant medication, things like that ought to be considered. So we choose with you, but these are some of the things that are available. Remember, if you've been on medication, let your partner know, so that use a barrier during the period when you've been on medication. Otherwise, the efficacy or how well that method will work may be compromised because of the other medicine that you are using. And then there's also the mist pill. I want to emphasize here on the mist pill and how it's managed before I go away from the pill. If you have missed a pill today, you had suddenly to travel, you had to travel somewhere out of town for an unexpected event, someone called you for a job opportunity and you traveled, you forgot your pills. Take the pill that you were supposed to take on the day that you have remembered, plus the one that you missed. And then for that rest of the week, 7 days of continuous use condoms as a backup, because that time when you missed your pill, you may have ovulated. But after 7 days of correct use, at least the risk of ovulation is controlled. So you can go back to using. So this, you have to communicate with your partner. If you don't tell your partner, oh, I forgot, so this is what we have to do. If you forgot 3 pills, take pill number, the one you are supposed to take for today, plus the one you are supposed to take yesterday. This one you can discard, and make sure you use barrier method for 1 week after the mistake was made. That way you remain well protected. So that's how we manage to take our missing pill regime. The next hormonal method is the injectable. Injectables include the 3-month injectable or the 2-month injectable. These are the ones that are commonly available. Depo-Provera is 3 monthly. Noristerat is 2 monthly. These are still in the short-term period. They are widely acceptable as well, because people can use the method and then continue. If you miss your appointment, your healthcare provider will give you an appointment. If you miss the appointment, please use condoms until 1 week after that injection has been given. Then you are good to go for your usual and protected intimacy. All of these, you can see, need partner cooperation. Now, with these hormonal methods, particularly the injectables, there are common intermenstrual disturbances. Some people will have spotting, some people will have irregular bleeding. They require understanding and coming back to us for assistance. If in spite of trying this and that, we give you this medication, it's not going away, life is becoming too much a hassle, then it's better we go back to the drawing board and see if this method is really for you or we are better off trying something else. So let's keep interacting on the different ways. If there's just light spotting, maybe just a brown tinge on the panty liner, it's not really bleeding heavily like a period. That should not even preclude intimacy, for example. That is just one of the side effects of the hormone, and people should not feel scared because that spotting can occur for some time, but it may need attention because as women, no one wants to be spotting for the longest period of time. So please, let's continue with interacting with the healthcare providers. It doesn't matter if you got the injection or the implant in Chirundu, you are now in Lusaka, you don't have to go back to the one who gave you that method. We are all ready to assist the mothers. I think the aim is to make it as user-friendly as possible and to make the method mix as broad as possible. Okay? So the longer term method for hormones is the implant. There's Implanon for 3 years, and then there's Jadel for 5 years. Now, immediately you mentioned 5 years, people are like, okay, I didn't say I want to stop having children for 5 years. No. It's just 5 years as long as it's in your body. If you want to use it for 2 years and remove it, your fertility should be back to normal within 6 months of use. If you come and ask and say, Dr. Muni, I did have Jadel, but now I've been trying, it's now 6 years, that's too long for you to seek help. If you have been trying after removal of an implant or after stopping your birth control method and it has been, say, 6 months to a year, there's no harm in coming to see us to help induce ovulation. Sometimes the system naps a little bit or starts idling a little bit, but it does not cause infertility per se. Because when we look at infertility, that's another can of worms. There are other factors to consider. Remember that these methods don't protect against sexually transmitted infections. As such, are your tubes still open after all these years of use? Is anything wrong with your partner's semen or contribution? Before we blame the family planning method. These are reversible methods, and it doesn't take much to reverse the effect.
I need you to go back on that one and really emphasize, because one of the concerns that women have is that after using these contraceptives, they are struggling to get their fertility back. And I've heard several women come up with this issue. Can you just, re-emphasize that just for clarity?
Okay. So let's look at some of the things that are involved in the fertility ladder. Some of these methods, for example, if I start using the method at the age of 35 and I use the method for 5 years and then I take it out, by nature, my fertility has dropped because of my age. Let us remember that women have a biological clock. Sometimes when we see our periods, because we have our periods until we are about 50, 55, we feel that since the period is still coming, the fertility is still there. But by nature, your fertility starts declining from age of 35. If you have had issues in the past with trying to fall pregnant, you really have to discuss with your doctor the choice of method. If you are in advanced age, you have to discuss with your doctor the choice of method. Some people are better off really not starting to inhibit their ovulation per se. they are better off leaving their system like that. Not because the pill itself causes infertility, but because of their own natural circumstances. So let's remember that we are aging as the years are going by on these, and most people use these hormones for these methods for years. By the time you want again to try, this time you are 38 years or you are 39, time has gone. So so this is something that we really need to look at. It's the same thing with the weight gain. People, the way you looked when you were 16 years old, if we look at you when you are 33, even if you are not using birth control, the tendency is to start putting on weight as we get older. And the fact that as we get older, we also now take reproductive roles, it's easy to blame the pill and other methods for our weight gain. But some of the weight gain is just constitutional and is coming with age. There is a little bit of weight gain from the pill, but not very significant, and most of it is due to water retention. But in some people, just the perception puts them off. So I want you to remember this as you are using the pill. Please discuss with us if your age is a factor. I'll give you an example, and this is a personal preference that I advise my mothers. If I have a mother who's starting her pregnancies at the age of 36, at the time they are discharged from our care, we have to emphasize when are you planning your next one? How are you going to avoid falling pregnant unexpectedly in between without necessarily falling prey to that biological clock effect? So all these things, it's quite a complex interplay, but not something that is impossible. We just need to communicate a little bit more. I'm glad you are available. You are there to guide. I'm available. I'm here to guide. No one should feel orphaned. All that is required is time, patience, and information.
So now, Doctor, let's take questions from the people who've been following this conversation. I've seen that there's been a lot being discussed, and I've been following the comments. There's quite a lot in the comments. So, ladies and gentlemen, this is your time. This is your turn. Dr. Mioni is here. Ask your questions. Okay. All right, this one. Let's take this question. So the question here is coming from Mildred Netsai Mwanza. Her question is, practically, we tell women that the Jadeos and the like cost the government a lot of money. No. It's not the question I wanted. No, the question is this one. Yeah. The question is from Alice. Alice Ndekazi Mvula. I think her question was, she had Jadeo for 9 months and had to have it removed due to prolonged PMS. Was prescribed with microgynon and menifib. Now she says, I'm now experiencing appetite loss, body tiredness, and headaches. Is this normal, doctor?
Okay. Yes, these are normal side effects of progesterone only, and indeed hormonal contraception. Some people may have headaches, but taking a lot of water and keeping well hydrated does help towards these. A lot of us women don't rehydrate adequately when we are on these hormonal methods, but headaches are quite common, especially with the implants. So if you take paracetamol or a regular painkiller to ease your headache, and you are taking enough fluid, you are taking enough rest, you should notice an improvement in your symptoms. Both microgynon and menifib, I think, are there prescribed to ease the symptoms or the hormonal imbalance caused by the jadel. And particularly, the menifib helps relieve premenstrual syndrome. But like I said, if your condition is becoming too much of a challenge, then it's time for you to come back. If you are using Jadel, it sounds to me like you want a longer term method. Perhaps you should try an IUCD, though I know people also have reservations about that. But it's about quality of life, Alice. I wish you all the best.
Thanks, doctor. Next question comes from Patience Holmes. So Patience Holmes wants to find out, I have Implanon for about 2 years now, and her issue is that she has not seen her P's.
That's very normal. As soon as the Implanon is out, your periods will start again. In fact, a number of people, actually, even those who don't need the Implanon for family planning, use them just to avoid having a period. I know that may not be quite correct, but of course, it's not unusual. Even with Jadel, even with Depo-Provera or Noristorat, the progesterone only, you may not have a period at all during your use. It's not like somehow the periods are being stuck somewhere in a corner of your body. And some women say, for me to breathe, kuti nipeme, I have to have a period. No, it's just not forming patients. So that's normal. Just enjoy your Implanon. It seems to be working well.
So we have a question from a man, and I need you to take this one. This is David Chris Chilofia. So David is asking, what alternative methods can ladies who rely on morning after pill use? Doc, that pill is the big reason why a lot of single ladies in Lusaka are not mothers. What's your reaction to this? It's coming from a man.
I'd have to sit down with them, David, and see how frequently are they having intimacy, for example. If, for example, you are just meeting your partner once in a month, maybe that can be acceptable. But then one can also opt to use condoms. One can opt to use a daily pill. The aim is to keep your biological clock regular. That emergency pill is for emergency, but it will disturb your hormones and bring about irregular period. And if your period is irregular, it's hard to predict when is your fertile time. So it's better to just take a low dose daily pill for the lady so that whatever time the intimacy comes, you are ready. I think that is fair enough.
Thanks, doctor. We have another question here from Mufuata M. Kathy. How long does one stay without pregnant after using Depo? I think another way of asking this question is, of course, when you're on Depo, you are not expected to get pregnant. Maybe the issue here is they've stopped using Depo today. When should they expect to get pregnant? I think that's how I've understood the question. Because otherwise, if you're on Depo, we don't expect you to get pregnant, do we?
So anytime from the time you have stopped using it up to 6 months is a reasonable time to have the hormone out of your system completely. So if you have gone after 6 months, you are still trying, then you can always visit us and see. But even up to a year, one can wait, not more than that. So anytime, some people immediately after stopping, the following month they fall pregnant, but others it takes a bit of time, and no one should panic. But remember to visit us after 6 months to a year of regular intimacy and your period has resumed. If your period still has not resumed after discontinuing the depot, then please come in. You don't have to wait for a full year for your period to resume.
There's an interesting question here. I hope I can get it up. Yeah, this is from Wenzi Mlenga. Can the morning after pill work, even if intercourse takes place on a day that a lady is actually ovulating?
That one it's high risk. It's a high risk one. Like I said, it's for preventing ovulation. If you have already ovulated, then it's better to use a barrier method than emergency pill, because there's no telling if conception will take place since the egg is already on its way, and the pill may not necessarily prevent that pregnancy from taking place. It works best before ovulation, before the release of the egg.
So once the egg is released, this morning after pill is not a good alternative. The horse has already bought it. I see. There's a man here who is asking me as a question. Okay, so guys, please pay attention to that question. The previous question was, if the lady has ovulated, do not bother with your morning after pill. It may not wait. Now, there's a question here, Doc. This is from a man. He's asking, do we have any contraception for men?
Okay, so we do have the male condom is there, as well as we had talked about natural methods such as withdrawal, as well as the permanent method, vasectomy. So those are the three that really require men's cooperation. That's why even from the beginning, we applauded the fact that you men are taking part in the discussion, because you do have your role to play in supporting the woman and also on your part. There isn't like a wide variety like what the women have, but what we have available for you is the barrier method, vasectomy, and for natural methods, withdrawal method.
Right. So, Dr. Mioni, we have actually come to the end.
I want to emphasize something.
I need you to answer this one before we leave. Emphasize.
That withdrawal method, just remember that even before ejaculation, there's some semen that comes out. So you really cannot, if you really want to avoid pregnancy, please use trusted methods that are more reliable, because even before a man ejaculates, there's some semen that comes out that has spermatozoa.
There's this question here. Wendy, I think Wendy will close with your question. Our question is, what method can a woman use with an underlying illness plus C-section?
Okay, so for starters, you sound like it's a mother who's just given birth. For mothers who have just given birth, we don't use combined pills in the first part, the first 6 months after delivery, because those tend to lower the milk supply. We tend to lean on progesterone only type of pill, of contraceptive, whether the injectable, the mini pill. Those can be started from 6 weeks after birth. If someone is doing exclusive breastfeeding, that in itself is also a natural family planning method. That's if you are not using also formula or the bottle. After 6 months, we can then use things like the copper T or the loop as an additional method, or the combined oral pill. Things like condoms can be used at any point. I hope that's helpful, but take time to discuss, especially since you have brought up the issue of underlying illness plus a cesarean section. It means we would have to choose with you what is safe for you to take.
So, doctor, we've had this conversation. After all is said and done, what is your take-home message? If the people who are following this conversation should forget everything we have said, what is it that they shouldn't forget? Your take-home message, Doctor.
The take-home message is don't be under pressure from anyone, both the males and the females. Look out for yourself. Look out for yourself, both infection-wise, both with regards to contraception. Let's come away from traditional practices like, no, we should just be having sex without thinking of consequences. Let's have planned pregnancies as far as possible. So the take-home message is look out for number one. Look out for yourself. If you are able to use a method, well and good. If you feel ashamed, contact us. We are here. There's no judgment in these walls. It's better to use contraceptive than have unplanned pregnancy. If you have unplanned pregnancy, please seek us out to assist.
Thank you, Doctor. We will call upon you once again, and thank you for making yourself available to serve your country and your people. We will certainly come back to you for another exciting topic. Good night, Doc.
Good night. Thank you.
Ladies and gentlemen, there you have it. So we just had this very exciting conversation with Dr. Muni on contraceptives. And like we keep telling you, or like we keep asking you to do, please share this video as much as you can. We need this information out there. We need a lot of our women and men to be made aware of issues relating or issues surrounding contraceptives. As you may be aware, there's a lot of misinformation out there. And just by sharing this video, you are helping to solve some of these health challenges that we have as a country. For healthy and prosperous citizens, this has been your Sunday edition of Ask Dr. Mjajati Sunday, and today we were tackling the issue of birth control methods. Now, if you missed this video, or if you know somebody who has missed it, please ask them to subscribe to our YouTube channel, and it will be easier for them to navigate our videos from YouTube. Do take care for health and prosperous citizens. Until next Sunday, good night.
What can you do with 5 kwacha? Not a lot. A 5 kwacha auto boost can get you 1,900 kwacha extra IO cover. Bernard Mulindu auto boosted, and Bernard received a total payout of 2,070 kwacha when he needed it most. Here is Bernard's story.
My name is Bernard Mulindu. Waimpongera na moto. Kaeni ko hospital check. Itakuwa ipo na problem 296 hash. Tungasanya kwa chatu. Ametumira kwa 257. Kawe manda kusongera tukikala mukulazichi yako datawole bomba. Alipira kwa nabana ku masuku. Aba balipigwa wale bomben tuisuma sana.
Dial star 296 hash to auto boost and quickly grow your IO recharge with care cover each time you recharge. IO together with MTN. IO, because you care.